Hey, hello, this is Chris South with the Easy EMT, bringing you some exciting educational stuff. It's free. It's always on my YouTube channel. So subscribe and tell me how you like the videos. So today we're going to be talking about things that bite, sting, and sometimes can kill. We want to understand some of the venomous creatures in North America. So let's get started. So question for you guys. What animal kills the most people in North America? Any ideas? Believe it or not, it's not a snake. Farm animals, actually, such as cattle and horses, kill the most people in North America, followed pretty closely by attacks by domesticated dogs. So oftentimes we think about dangerous animals as creepy crawly things and everything, but actually we see a lot more injuries and things from domesticated creatures, but that's going to be for another video. So let's get down to what you're really looking for as all those creepy crawly things. So the purpose of this presentation is to give information about poisonous animals and insects in North America. We're not going to be talking about anything that lives outside of basically North America, especially in our area here in the United States where we work. I will, if you're interested, I can absolutely put some other videos out about some other interesting creatures all around the globe. But it's important. It's going to help us to give better care through understanding of these animals and insects and how this venom works and what some of the bites look like as well. So the other thing this presentation is going to be helpful for us, for you guys that are traveling or anything, is knowing what not to touch and how to fix some of this stuff, especially get down toward the sea life stuff. We'll give you some really good tips and tricks that's going to help you out a little bit. So let's look at the thing you're all wanting to look at, our snakes. So that's the rattlesnake. There are different varieties found within North America. Some can be quite small, like the pygmy rattlesnake, all the way up to this gigantic guy right here, which is the eastern diamondback. All of these are pit vipers, and all of them have a very, very toxic venom that's injected into their fangs. Most of the time, rattlesnakes do give off a rattle to warn potential people coming around that they're there. One of the things is not every rattlesnake will rattle prior to a bite. This is a rattlesnake bite. As you can see, there's already starting to be some necrosis of the tissue and quite a bit of swelling around it. Rattlesnake bites can be very, very painful. Rattlesnake bites can be deadly. And anytime you have a rattlesnake bite, you don't need to stay at home or anything. We need to transport these patients immediately to the hospital. The treatment of choice there is going to be a medication, which is an anti-venom called Crofab. The copperhead. The copperhead are a little more, they like to kind of hide and stay off to themselves. Most people who are bitten by copperheads are accidental bites, is where they're too close to where they live at. The copperhead gets scared and bites them. I had my niece, Aubrey, a few years ago. We got bit in my backyard by a copperhead. She was playing a little bit too close toward the woods, kind of later in the evening, which is a terrible time to play close to the woods. So a lot of people do get bit by copperheads. So the copperhead bite is very similar to how the rattlesnake bite is in appearance. Can have quite a bit of swelling and stuff. People can have some pretty severe reactions to them. Any patient that has a suspected copperhead bite needs to go in immediately for care. And with the copperhead and the copperhead bites, we need to be doing all of those supported things, supporting their airway, breathing, and circulation, because depending on the severity of the envenomation, it could potentially affect those systems. So the cottonmouth, also known as the water moccasin. The big thing about the cottonmouth is it will often open its mouth very, very wide, and as a threat. When it's threatened, it will have this display that will try to get you away from it. They're mostly aquatic creatures. You find them quite a bit around the water. Their venom is very similar to the venom that's associated with the copperhead. Anytime as well, make sure that with any of these bites, for supporting those ABCs, getting this patient to the hospital. There are treatments available for the cottonmouth and also for the copperhead as well. So this is a cottonmouth bite. Now this guy was in the paper not too long ago. This guy's a real moron. I'm just going to say it. I'm sorry that he got bit, but you don't pick up cottonmouths. and he got bit, and he got bit in his face, as a matter of fact. They don't like being played with. Please don't play with snakes. Leave them alone. Let's enjoy them from a distance. So the coral snake, not to be confused with the other one, but with the different stuff. So a good way to identify the difference between the coral snake is if it's red, touches yellow, you're in danger, fellow. So the coral snake. Now the bite, coral snakes are quite small animals. They're not very big. But the coral snake can, this has got a picture of the other kind of snake there, but if you look in number B, the coral snake bite is really similar in appearance to a non-venomous snake bite. It's got little teeth and everything. As it chews onto the victim, it injects more poison. Now, the coral snake anti-venom is not readily available in the United States as it once was because of the cost associated with getting that anti-venom. But coral snake deaths are quite rare, but anybody can have a bad reaction to it. So before we go on to some other venomous reptiles, you will see a ton of like snake bite kits and everything. You can even go to REI, whatever adventure store that you go to, and you'll find these kits for snake bite kits. Couple of things. Number one, these extractors is where you try to suck the venom out. Never works. You got to remember this is an injection. So once it goes in, it's not going to be localized just to the site. That venom is going to start traveling up away from it, and it can become systemic pretty quick. So don't waste time trying to suck it out and spitting the wounds out or aggravating that wound site anymore. The best thing is to keep the site where the bite happens still. Let's immobilize it. Let's treat it. Let's not put constricting bands or any of that stuff on. Let's just get the patient to the hospital as quickly as possible. So some other venomous reptiles, there's actually only one I want to talk about, is the Gila monster. So the Gila monster is one of only a handful of venomous lizards in the world. It's actually the only one that's around in North America. Others include similar-looking Mexican bearded lizards, as well as iguanas and monitor lizards. Its venom is kind of a mild neurotoxin, but it's very, very painful. Nobody has died yet from the result of a Gila monster bite, but everybody can react differently to some of these poisons and stuff. So you could encounter one of these guys, especially if you're traveling down to the Southwest. Spiders. Yeah, spiders. So the brown recluse, which has a distinctive violin-shaped marking on his back. You can kind of see the violin right there on the front part of his body. It's the most commonly found beneath rocks or in wood piles. Yet the venomous spider can also hide in seldom worn clothing or shoes or basements, attics and crawl spaces. A lot of times we put our summer clothing and stuff away. That's a perfect place for these little guys to hide. So I always tell people, as when you're getting new clothing and stuff you haven't worn for a while, give it a good shake. Maybe you can scare one of these guys off. A brown recluse may attack if provoked, and its bite can cause blisters, fever, and difficulty sleeping. Can also cause some other things. Although the bite is typically not fatal, it can be. People can have some pretty severe reactions to the venom. And one of the other things is it causes necrosis. Those blisters can actually rot all the way through the skin, and people can have to have surgeries and skin grafts, all kind of nasty things. So brown recluses can be deadly. So there's a brown recluse bite. You can see the severity of that bite as it's starting to cause some necrosis of that tissue. The black widow spider, it is a small but terrifying pest. The black widow spider has a distinctive red hourglass marking on its belly. Its bite, believe it or not, is 15 times more venomous than a rattlesnake bite because it's just a little bit of venom. Causes muscle pain, spasms, and abdominal cramps. It's also a very potent neurotoxin and can cause some very, very terrible systemic problems with the patient. While an encounter with a black widow is rarely fatal, it can be, and this is rarely, we can still have some of it. You should still avoid disturbing its common hiding places like wood piles, hollow logs, and crawl spaces. Basements are great places for this guy and also for that little brown recluse to hide as well. Let's take a look at the bite. Yikes. Insects. Believe it or not, there are tons and tons of poisonous insects that live within North America that can cause us some problems. Let's take a look at a few of them. So ticks, well, ticks are not poisonous, but however, I wanted to include them in this list. Ticks usually hide in grass or thick foliage where they latch onto humans, dogs, cats to extract their blood. It's what they feed off of. Many tick species are harmless, but the notorious deer tick can spread Lyme disease, anaplasmosis, and berosis. These conditions are associated with fever, neurological issues, and joint issues if not treated. On the bright side, removing a tick within 36 hours significantly decreases your chance of contracting a dangerous infection. Always check yourself after hiking or camping in tick-infested areas. And believe it or not, guys, in EMS, it's probably, if you're going to have an area where you have ticks, it's not a bad idea to have a tick removal kit as part of your material in the ambulance. Believe it or not, a lot of times, especially if we're working outdoor events and things, people will come up and ask us to remove a tick. And you need to make sure that when you're removing the tick that you get all of the tick out. Things that people used to do back in the day was to get a match and light it and try to burn the tick out. Doesn't work. What you do is a pair of tweezers. What you want to do is to grab it by the head and pull it directly out. Ticks cause some very, very severe problems. A lot of people have devastating diseases like Lyme disease because of ticks. So if you see them, pull them out. And it can be very, very tiny, just like this one. So scorpions are frightening. I'm terrified of scorpions. Scorpions are nocturnal pests typically found in warm, dry climates like the desert. Most American varieties don't have lethal venom, but they do have venom, like the ones in Africa. But their sting is still very painful. To avoid an unpleasant encounter, always wear shoes outside at night. Put on those gloves when working in the backyard, especially if you're turning over rocks, that kind of stuff. And shake out any clothing that's been left in the garage or outside because they like to hide in those places. Let's look at some of our stinging insects. So the first one on the left here is we have the American honeybee. The honeybee, especially here in North Dakota, is a big part of our life here with the agriculture. We actually bring bees up here to help as part of the agricultural process. The thing about the honeybee is it has a barbed stinger. So once the bee stings, as it pulls away, it actually leaves part of itself embedded into the skin. So it's very, very important for us to remove the stinger. And you can simply use that with a credit card and kind of slide it over there. But be careful, if you pinch the sac, it's going to cause more severe reaction because it's going to inject more of the poison into the patient. The next little guy over here is, of course, the yellow jacket. Yellow jackets can be found in just about anywhere where we're outside. They do sometimes build their nest into the ground. Anywhere they can build a nest, really. Yellow jackets are very, very aggressive. Usually when you find one of them, there's a few more of them around as well. They like really sweet things. You can usually find them around pretty quick when you're having your picnic outside. They do not have a barbed stinger, so they can sting multiple times. So paper wasp, which are right here on the left. Some people call these guinea wasp, red wasp, all kind of things, but they're called paper wasp because they actually build a nest out of paper. You can see them, especially down where I'm from, down south, as you can see them under eaves and overhangs and places like that. Again, they have a very powerful sting and they can sting multiple times. So over here on the right, this is the bald-faced hornet. Hornets make those nice, big, huge nests in trees, and they can also be found in houses and things. Hornets have a very, very powerful sting. If you come across a hornet's nest and think it's a good idea to throw a rock at it, you can get multiple stings. Stay away from them. The cow killer. The cow killer is not really an ant at all. The red velvet ant, which also goes by the name of cow killer, is not an ant. It's actually a wasp. Pains can be very, very painful, and you treat it just like you would any other sting as supportive care. But you have to remember that any stingy insect or any animal that injects poison, there's always a possibility that this patient could develop a severe reaction or go into anaphylaxis. So always be able and standing by to treat those problems, difficulties with airway, breathing, and circulation, but also to have your epinephrine on standby and maybe some other drugs as well, such as Benadryl to treat the symptoms, and even some Pepsi would be Not a bad idea. Red fire ants, the scourge of everybody in the South. These are mostly located in the southern United States. Fire ants live in impressively large mounds. Every person I know, once you put out all the stuff to get your grass nice and green and beautiful, along comes some fire ants to make a big, huge mound and ruin it all. They range from 2 to 4 square feet in size, the mounds do. If you spot a mound near a structural foundation or the sidewalk, don't disturb it. Fire ants will retaliate with a painful sting that causes painful large welts on the skin. And you can see just how tiny those little fire ants are, but don't let their size fool you. They pack a powerful, powerful sting. It can be quite painful. The kissing bug. Kissing bugs may sound cute, but they're actually quite frightening. They are nocturnal creatures that bite humans around the lips and eyes. Ugh. One mark from a kissing bug has the ability to cause Chagas disease, a dangerous condition that damages the heart, the central nervous system. All these critters are mostly found in South and Central America. They are sometimes seen in Texas and other southern states. They're actually starting to be more prevalent in the southern states, especially in Texas. The pus caterpillar. Oh, it's so cute and furry. This furry creature is often described as being cute, but something this poisonous can't possibly be described as such. It's very, very painful. It's located in Florida. This caterpillar is North America's most poisonous by far. A single touch of the bristles can result in severe symptoms, including vomiting, fever, and a drop in blood pressure. So be on the lookout. So if you're down in Florida, going to see Mickey Mouse down there, and your kids see this nice little furry caterpillar, smack their hands and don't let them touch this guy. If you're up in Maine, the brown-tailed moth. Found in the northeast corner of the United States, the brown-tailed moth is often overlooked as a dangerous insect because it resembles many other harmless moth species. Kind of looks like every other moth I've seen around. The hairs of the brown-tailed moth break off upon contact and stick in the skin like barbs. The barbs cause itchy rashes that can last for weeks at a time. But the main thing with it is if it's inhaled, if those little barbs are inhaled, it can cause some severe respiratory problems. So all you folks heading down to Florida, let's talk a little bit about sea life. Or if you're going to Cancun, if you're wherever, these are good things to know. Jellyfish. The picture right here is one of the very, very most painful jellyfish stings to have. This is a very beautiful to see this guy in the water. He is called the Portuguese man of war. These squishy creatures injure beachgoers far more often than any other type of sea life. Since the sting from a jellyfish tentacles can prove painful even when the creature is dead, smart beachgoers everywhere give them a wide berth both in the water and along the shore. You step on one or get near one, pieces of their tentacles can be around, and if it gets on your skin, you're going to have problems. So this is what the sting of a jellyfish looks like. You see it's very welted area, this area that's swollen, very painful indeed. So jellyfish treatment, seek medical help right away if you're by yourself. As soon as possible, rinse the sting site with a large amount of household vinegar for at least 30 seconds. Whenever I go to the beach now, I always stop and get some vinegar to carry with me just in case. Vinegar is safe and effective for all types of jellyfish stings, and it rapidly halts the thousands of tiny unfired stinging cells left on the surface of the skin after tentacle contact. If vinegar is not available, the sting site should be washed off with ocean water, not tap water, not water out of your cooler or anything. If you use that, what it will do is it will actually cause those jellyfish things to actually activate and sting all at once. Protect the affected area and do not rub sand or apply any pressure to the area or scrape the sting site. You can soak the area in water from 107 to 115 degrees at standard tap hot water, not scalding, just hot. For 20 to 40 minutes will ease some of the pain. After soaking in hot water, apply an antihistamine or steroid cream such as cortisone cream. It can help with some of the painful itching and burning. So one of the other things that people can get bit by is called sea lice. So it's not an actual lice. What sea lice is are very, very small jellyfish. and treatment is exactly the same. Sea urchins. Step on one of these spiny round invertebrates and you'll be sorry. They're most common in shallow waters near sandy or rocky shorelines and on subtropical coral reefs. Urchins can inflict a painful wound when a spine penetrates human skin. I got into one of these not too long ago when we were down in the Bahamas. I can tell you firsthand it doesn't feel very good. So there is a sea urchin sting. As you can see, there's plenty of little splinters that are stuck in this guy's foot. So you can, again, immerse the affected area for 30 to 90 minutes in water as hot as the injured person can stand. Repeat as necessary. The hot water will control the pain. Use the tweezers to remove any large spines in the wound. Remove the little things by applying shaving cream to the affected area and gently scrape with a razor. Scrub the wound with soap and water, followed by extensive flushing with fresh water. Do not close the wound with tape or glue or skin, like new skin, things like that. If signs of infection such as pus, redness, or heat occur, apply topical antibiotic ointment, but you really need to call your doctor, and they're going to prescribe antibiotics or maybe some other different treatments. Relieve pain with the recommended doses of acetaminophen, such as Tylenol, every 4 hours, and you can alternate between Tylenol and Motrin. The lionfish. Lionfish is really kind of a gorgeous fish. Widely established along the East Coast, Caribbean, and the Gulf of Mexico. These showy swimmers are lovely to look at, but tricky to touch. The lionfish spines deliver a venomous sting that can cause extreme pain, sweating, respiratory distress, and even paralysis. So unless you're an expert, don't touch them. If you're lucky enough to get stung by a lionfish, you need to seek immediate medical attention. I'm going to show you what a lionfish bite looks like. This happens more to divers who are around reefs and different things where the lionfish likes to hang out at, and they come into contact with this unfortunate creature. And you can see some blanching of the skin and some severe swelling. So the treatment, whenever possible, you need to wear gloves when you're trying to remove any kind of stinger or anything. Brush off those tentacles and stingers with a credit card or a similar object if possible. If you don't have a credit card, you can gently wipe off the stingers or tentacles with a towel, but don't rub the area too roughly. Wash the area off with salt water, and you can soak the wound. Make sure that you're using hot water and stuff, that you test the water because it can become too hot and you can injure yourself, especially with children. So the stingray. Common throughout the mid-Atlantic, southeast U.S., Caribbean, and the Gulf of Mexico. Stingrays often swim within a few yards of shore where they prey on tiny fish and shellfish. They're kind of known to lie on the bottom and cover themselves with sand, which is how most people get stung. So what I tell people is if it's the first time going to the beach, you haven't really been around it or anything, is when you're kind of getting into the water, is shuffle your feet. Don't just stamp and stomp as you're running out there. Is shuffle your feet. This can oftentimes prevent you from coming into contact with a stingray or stepping on them. Stingrays are not aggressive, but if you follow one too closely, you run the risk of catching the business end of the stingray's sharp, painful stinger. It does have it's a stabbing. It's like a barb. This is how the crocodile hunter died. Mr. Steve Irwin, fantastic individual, but he was unfortunately spined by a stingray, and it ultimately caused his death. He was spined in the heart by one of those. Anyone stung by a stingray should be at the nearest medical facility as soon as possible for treatment. Let me show you what a stingray barb looks like. This patient has a pretty mild injury, was injected with the barb of the stingray. This patient is going to require removal, more than likely a tetanus shot, maybe some antibiotics just in case for infection, but they're going to definitely require an x-ray to see if there's any underlying damage to that patient. Stingray treatment. If anything else, we're going to do breathing support, including oxygen. We may have to place the patient on a breathing machine depending on how severe the reaction is. We want to do an EKG, give intravenous fluids. Medicine called antiserum to reverse the effects of the venom. They're typically going to have that close to where these animals are found. Other medications treat the symptoms, and again, a tetanus shot if necessary. All right, guys, so what I want to do now is kind of close and talk about any of these things that I just showed you, especially with the insects and things. anybody who gets a substance injected into them can always run the chance of having an allergic reaction. So anytime we have an envenomation, whether it's through an insect, a snake bite, sea life, or whatever, we should always be suspecting that this patient could potentially have a severe reaction and possibly go into anaphylaxis. So in EMS, guys, always have your epi ready and on standby, and always have your airway equipment ready in case of an emergency. So guys, I hope you don't come into contact with any of this stuff, but if you do, it kind of gives you some insight. And a couple other things is, please do not bring the snake with you to the hospital. Leave that where you found it. Anyway, guys, have a great day. I hope you enjoyed this presentation.